A lot of countries are in the midst of a devastating dementia crisis, and it's only going to get worse, warns a top Sydney neurologist. The advances of modern medicine have contributed to an aging population, meaning the rate of dementia-related diseases including Alzheimer's has climbed rapidly in recent years. According to the Australian Institute of Health and Welfare, dementia has now overtaken heart disease as the leading cause of burden of disease, the impact of living with and dying prematurely from a disease in elderly. Professor Matthew Kiernan, neurologist and president of the Brain Foundation in Sydney, says the alarming statistics sadly come as no surprise to those who are involved in dementia research. Because we've got an aging population, it's going to become far more prevalent, Professor Kiernan explains. With conditions like heart disease or a stroke, there are preventative measures like exercise or monitoring your blood pressure, but dementia encompasses a whole suite of conditions and it can be hard to know why or how to prevent it. Among Australians aged 65 and older, dementia, an umbrella term for a range of brain disorders, is responsible for about 230,000 healthy years lost. It's a figure that has increased by 61% since 2011. Professor Kiernan describes it as a tsunami of newly diagnosed patients. Presuming we don't have a cure in the next 30 years, it's going to overwhelm the healthcare system, he says. In the next 10 or 20 years, we're going to need a brain plan. This is what our politicians need to take on. This huge rise in dementia patients will also mean the world will require millions more carers and aged care employees. Professor Kiernan explains it will be a major financial burden that needs to be planned for now. People are getting dementia in their early 60s. That means family members and children are involved in the care and will be out of the workforce. He says, it will be a financial catastrophe. Dementia organizations from around the globe has also long reiterated the need for the healthcare system to be prepared for a continued onslaught of these diagnoses. Dementia organizations reinforces the need for an interconnected, dementia-informed healthcare system to ensure everyone impacted by dementia receives appropriate support and care throughout their experience of the disease, the organization states on its website. Researchers have spent decades and millions of dollars trying to find a cure for the debilitating diseases affecting the brain. Without a cure, Professor Kiernan says people should focus on preventative measures, which include daily brain training. While exercising the brain has not been proven to prevent dementia, it can reduce the risk or delay the onset of the disease. Other risk-reducing factors can include reducing alcohol intake, maintaining a healthy weight, incorporating physical activity, and staying socially connected. A cure is inevitable. It will happen one day. There will be more effective therapies, but we need to come up with a diagnostic for each condition before we can treat them, Professor Kiernan says. In the absence of definitive treatment, brain training and staying mentally and physically engaged with your environment is the best therapy. To lower your risk, the World Health Organization recommends 1. Be physically active. 2. Stop smoking. 3. Eat a balanced diet, like the Mediterranean diet. 4. Drink alcohol in moderation. 5. Cognitive training. 6. Be socially active. 7. Look after your weight. 8. Manage any hypertension. 9. Manage any diabetes. 10. Manage any cholesterol. 11. Manage depression. 12. Look after your hearing and manage hearing loss. Thank you for watching, and don't forget to look after your health and well-being.